Hi everyone, I'm Nurse Damaris. I'm here to guide you through pregnancy. In this video, I'll be talking about the signs and symptoms of pregnancy. In the subsequent videos, I'll be teaching you what to expect each trimester of your pregnancy, the cheap and affordable foods you can eat to stay healthy during pregnancy, how to dress properly during pregnancy, and the stages of development of the baby from the first week to the 40th week of pregnancy. First of all, I would like to say that pregnancy is not something that should be accidental. It is something that you should be intentional about. That is, you should plan and work towards it. Before pregnancy, you should consult a gynecologist or a midwife who will educate you on the things to do to have a safe and comfortable pregnancy. Your gynecologist may take your health history and family history to know if you're medically fit for pregnancy or if there are health issues from your family that can be passed on to your child. You may be asked to perform some laboratory investigation. If you are obese, you may need to lose weight to reduce the risk of complication during pregnancy. And if you're malnourished, you may need to feed well to stay healthy during pregnancy. Your gynecologist may prescribe hematoenics like folic acid, which reduces birth defects, and also advise you on exercises to perform before pregnancy to keep fit, and so on. So, consulting a gynecologist or a midwife before pregnancy increases your chances of having a healthy and alive baby. Let's now look at the signs and symptoms of pregnancy. The signs of pregnancy are divided into three categories. We have the presumptive signs, the probable signs, and the positive signs. The presumptive sign. The presumptive signs are changes that a woman experiences in her body that makes her feel she is pregnant. They are not completely true because they can be felt by regular women, so they are the least reliable indicator of pregnancy. They include amenorrhea, fatigue, heartburn, nausea, increase in urinary frequency, lightheadedness, etc. Let's start by explaining amenorrhea. Amenorrhea simply means the absence of menses. People see it as the first presumptive sign that shows they are in the early stage of pregnancy, but other factors like an irregular menstrual cycle, malnutrition, stress, early menopause, use of birth control, medication side effects can also cause amenorrhea. Fatigue. Fatigue is a feeling of tiredness. It is very common to feel tired during pregnancy because of the hormonal changes that takes place in the body. This usually happens in the first 12 weeks of pregnancy as progesterone level rises sharply. Breast enlargement. The breast enlarges as it prepares to produce breast milk for the baby. The breast tends to get fuller and heavier during pregnancy. The areola may become darker in color and increase in size. Heartburn. Heartburn is a burning sensation felt when the stomach acid flows back into the esophagus. It can be caused by hormonal changes and the growing baby pressing against your stomach. Changes in diet and lifestyle can help to relieve symptoms. Nausea. Nausea is the urge to vomit, which comes as a result of the changes in the first trimester. It is also known as morning sickness. This affects about 80% of pregnant women. Increase in urinary frequency. Pregnant women experience frequent urination in the first week of pregnancy as a result of the increased level of the hormone progesterone and human chorionic gonadotrophin, which increases blood flow to the pelvic area. Lightheadedness. The increase in hormones during pregnancy causes widening or dilatation of the blood vessels, which increases the flow of blood to your baby and reduces the blood returning to you through your veins. This lowers your blood pressure and reduces blood flow to your brain, temporarily resulting in dizziness or lightheadedness. Dizziness can also be caused by the growing fetus, which puts pressure on the blood vessels, etc. Probable signs of pregnancy. Probable signs of pregnancy mean that it is very likely that you are pregnant. These are signs that your examiner can observe. They are Goodest sign, Hegar sign, Chadwick sign, Braxton Hicks contraction, ballotment, positive pregnancy test, etc. These signs may be probably related to pregnancy, but there are still other reasons for them. Goodest sign. Goodest sign is the softening of the cervix which takes place at 6 to 8 weeks of pregnancy. Hagar sign. Hagar sign is the softening of the uterine isthmus. It is felt at 6 to 8 weeks of pregnancy. As the fetus continues to develop, the isthmus combines with the lower uterine segment. This also compresses the cervical isthmus. Chadwick sign. This is a blue discoloration of the mucous membrane, vulva, and vagina. You can observe it at 6 to 8 weeks of pregnancy through a bimanual examination. Braxton Hicks contraction. These are contractions of the uterine muscle that can start in early pregnancy, but they are most commonly experienced in the third trimester. It can also be called forced labor, but it is the body's way of preparing for true labor. Ballotment. In ballotment, the examiner inserts the tip of the finger at the vagina to push against the uterine wall. The fetus goes upwards, hits the wall of the uterus, and falls back. Positive pregnancy test. A positive pregnancy test can still be false. This is why it is classified under probable signs of pregnancy. Positive signs of pregnancy. These are definite proof of pregnancy. These signs are there because they can only be attributed to pregnancy. There is no other cause for it. Signs include fetal movements felt by the examiner, audible fetal heart rate. It can be heard through auscultation or visualization during an ultrasound. It can be heard from the 10th to 12th week by Doppler ultrasonography. Ultrasonography shows the image of the fetus, which can be seen by 8 weeks of pregnancy. So this concludes the signs and symptoms of pregnancy. If you find it helpful, please like, subscribe, and hit the bell button.